Hi, I'm Kristen.
And I'm Ashley.
I'm Nico, and we're Davenport nursing students, and today we're going to be making a video discussing our topic on sexual disorders and sexual assault for our mental health class.
There are many different types of sexual disorders, including those of sexual dysfunction, gender dysphoria, and those of paraphilic disorders. Paraphilic disorders refer to acts of sexual stimuli that are outside of what society considers normal. Criteria for being diagnosed under this category of disorders is having symptoms occur for at least 6 months. This disorder, along with other sexual compulsive disorders, can cause distress and can affect your health, job, relationships, or other parts of your life in negative ways. Pedophilic disorder is unfortunately the most common paraphilic disorder. However, the majority of pedophiles do not want to harm children and actually may never will. Finding some type of support is a way for these people to gain control and avoid doing anything that they do not want to do. Our first scenario will focus on a client who comes into the clinic looking for help for his cousin for a situation related to this disorder.
Hi, my name is Ashley. I'm going to be the nurse helping you out today. What brings you in today?
Well, I was hanging out with my cousin earlier this week, and he's a full-grown adult male, and he mentioned having a sexual interest in children. He's not really sure how to go about it because he knows it's wrong.
Okay. That must be very confusing and difficult for him. Has he ever done anything to act on these feelings?
Nothing yet, and he said he doesn't want to.
That's good. I'm glad you came in today. We can help you come up with some coping strategies maybe that you can share with him that might fight the desires that he's been having. Sometimes these desires can lead to other problems such as depression and anxiety. Have you noticed him being depressed or anxious at all?
Yeah, he's been very anxious and depressed lately because he feels like he's a bad person for having these thoughts and these desires.
Okay. Do you know if he's has had any suicidal thoughts or anything?
No, nothing that I've noticed.
Okay, good. Sometimes it works for patients to journal about their feelings and identify any personal triggers that they may have that can, and this can help them avoid them if possible. It sounds like he already has some self-restraint of these urges, so it might help him to get his feelings out on paper, and it can be a positive release of his feelings and urges rather than acting on them.
Okay, I'll try to tell him that.
Okay. So another great option is for him to attend therapy where he can receive social support. Cognitive behavioral therapy is used most often, and this can help him learn new sexual response patterns and decrease his urges. It's important that we also find him a specialized psychiatrist to talk with as well. If necessary, there are also 2 different medications available for his situation. These drugs can help decrease sex drive and break the compulsive deviant sexual behavior. Once we find him a psychiatrist, he can then talk more with his psychiatrist about those meds if he thinks they're right for him.
Okay, that sounds good.
Do you think these solutions might help your friend out?
Yeah, I'll suggest this up to him and tell him that maybe he should start seeing a psychiatrist and journaling, and maybe he'd look into it and give it a try.
Okay. So here's just a little bit more information about those medications and a list of recommended psychiatrists that you can give to him. Do you have any other questions for me?
No, this has been helpful.
Great. I'm glad you came in, and you have a good day, okay?
You too.
Thanks.
Alright, the next part of our video is going to focus on sexual assault. We're going to play out a scenario in which the patient has been sexually assaulted. When talking to a patient who has been through something like this, make sure the atmosphere is quiet and comfortable. And also be sure to pose questions in a non-judgmental way and avoid asking why. Using the 3 C's, control, compassion, and confidence, are very important to give a sexual assault patient the care that he or she needs. It is important to consider that the patient might feel more comfortable talking to a nurse of the same gender. Make sure that the patient knows that they do not have to talk or they can stop at any time if they feel uncomfortable.
My name is Kristen and I'm a nurse here. I understand that you're having a difficult time right now coping with your previous sexual assault. I would like to talk to you about this a little more, and if you feel uncomfortable at any time, just let me know and we don't have to talk about it anymore.
Okay.
Tell me about how you've been feeling lately.
I've just been kind of feeling very on edge and anxious lately. I feel guilty because of what happened to me, and I feel like it was my fault. I also haven't been able to sleep very well at night, and I've been having lots of nightmares, and I just don't really know what to do.
This must be a very hard time for you. It sounds like you're experiencing a lot of emotions that are expected for your situation. Sometimes those who experience sexual assault are more prone to depression or suicidal thoughts. Have you had any thoughts of suicide at all?
Maybe a little depressed, but no suicidal thoughts.
Talk about your feelings of depression, but I'm glad to hear you don't have any suicidal thoughts. Would it be alright if we talked about some coping strategies that might be helpful to you with how you've been feeling?
Yeah, that'll be okay.
Okay, tell me about what kind of support systems you have. Do you have any family or friends that you know that know what you've been going through?
Yeah, my sister and 2 close friends know, and they're very supportive.
Glad to hear that. It can also be beneficial to talk to someone who you don't know, such as a counselor who has some experience in this area. Counseling is a good option for talking about what you've been through. It can be helpful to be able to share your experience with someone who can help you separate your issues of vulnerability from blame. Here's a list of recommended counselors in this area that you can look into more if you would like to.
Thank you. I'll look into these.
Sometimes it can also be helpful to express your feelings through journaling. This can help you sort through your feelings of guilt and anxiousness. Have you ever tried journaling?
No, I haven't, but that's a good idea.
Group therapy or support groups are another option where you can express your thoughts and talk to other people who have been through similar situations. Support in this way can help you to further develop your coping skills. Earlier, you mentioned having nightmares and having a hard time sleeping. If you have a nightmare, you can try to focus on breathing slowly and deeply and reassuring yourself that you are safe. Sometimes turning the lights on and checking the locks to make sure that they're locked can confirm your safety too.
Okay, I'll try that next time I have a nightmare.
Do you feel like this talk was helpful for you?
Yeah, I feel a lot better, and I now know about different options I have to help me cope with what's happened.
Great. Do you have any other questions for me?
Not right now.
Okay. If you have any questions or concerns that do come up, feel free to contact the office and make another appointment if you want to.
Okay, thank you.
Thank you. Have a good day.
So we know that these topics can be uncomfortable to talk about with patients, but it is important to be prepared and know how to handle them. We hope this video will help you in the future should you ever encounter patients in similar situations. Thanks for watching.
About this more, and if you feel comfortable, shoot.
Sorry, just-
It's okay. No, we can start it over. Just start it
start
over.
back.
I don't sleep very well at night, and I've been having lots of nightmares. Nico, we need you.
You're supposed to be scrolling.
Oh, I'm
No,
sorry,
you're
guys.
good. Maybe a little depressed, but no suicidal thoughts.
Okay. We can talk about your feelings of depression.
Got it out. Start over.
That's fine, 'cause it's
This
the
is
beginning.
terrible. So we know that these topics are uncomfortable to talk about with patients, but it is important to be prepared and know how to handle them. We hope this video Okay. So we know that these topics can be uncomfortable to talk about with patients, but it's important to be prepared and know how to handle them. We hope this video will help you in the future should you ever encounter patients in these similar situations. Thanks for watching.
You were so close.
All right, 3rd time's a charm. Okay, so we know that these topics can be uncomfortable to talk about with patients, but it is important to.
You can do it.
This is literally 3 sentences. Why is it so hard?
Just take a breath. Ooh.
I need to step away from the camera for a
Yeah,
second.
step away.